videos on. Dawn, Trev, SmashweRx. We're gonna go over some pelvic shear, and I'm gonna drag Dawn down here on the floor so we don't just see half her body.
Yep.
And Dawn, killer athlete. She's gonna have a baby. And so we're gonna go over some pelvic shear. You have this joint in the front of your pelvis. It's the ouch bone. A lot of us know we've hit it when we do snatches. It's got a disc in the front. Problem is when we have the pelvis like this, so imagine this is the pelvis, that disc gets offset because the innominate bones on either side start to shear past this disc because there's imbalances in the muscle pull. Remember, there's 20 muscles that affect the hip. We're not going to work on all 20, but we're going to teach you how to set that hip all on your own and take the shear off that pelvis, because that's going to transfer into how you basically drive horsepower into the bottom of into the ground. So when you're in your squat, for example, and if you have a pelvic shear, and this is where you are in the bottom of your squat, and there's a shear, what's going to happen is you're going to push a lot harder with one side than the other, and your catch, I know you probably can't see my feet, but that's okay, pretend you can. Your catch is going to be off like this, so you can see my right leg is a lot further forward than my left because your pelvis is sitting like this, and you have this kind of a position with your pelvis. So two things happen. One, you jam up that hip, you don't get that roll, slide, glide, and you affect how it rolls in the joint. You start to beat up that acetabular ring, and you start to mushroom the head of the femur. So it starts to lay down a bunch of calcium, and like 20 years later, you're in for hip replacement when it's probably preventable. So we're going to peel away the adductors. There's 4 in here, and off of the semimembranosus, we're going to use, it's like a hidden treasure. We're going to use a peanut. Dawn loves my jokes. And then we're also going to hit that high hip, so the glute med, the TFL, and then we're going to set that pelvis. So we're going to do that all at once, clear out that pelvis so you can actually do all the things you want to do without putting a lot of strain on the hips. It's going to end up clearing out the psoas and the iliacus as well, all because you take that shear off of the pelvis. So check this out. I'm going to use Dawn as an example because, well, she's awesome. And then after that, we're doing a killer muscle up workout. So what she's going to do, this is what you're going to do. She's going to lay down. She's going to lay down her leg. So one leg forward. So it's almost like a pigeon, except.
Can you see?
Yeah, absolutely. You're totally fine. Absolutely. So there it is. So what she's going to do is she's going to squeeze her glute as hard as she can, and she's going to drive this into the floor. So she's actually putting a shear on the pelvis, and she's going to feel it right here in the pocket, right? Super bad. Yep. In the hip flexor. And then she's going to hold this for about 2 seconds. Then she's going to switch sides and do the other one. So this one's going to come forward, and she's going to put the other one in the back. This is going to shear the other side. So I realize we're introducing a shear, but it's basically like a reset button for the muscles. So it's causing rectus femoris on this side, and it's causing glutes on this side, glutes on this side. It's going to hit the psoas and the iliacus on this side. It's causing them all to contract. But remember this, you contract and then you turn them off right away. They both stay relaxed for a good 20, 30 seconds. What's up, Andrew? He's making, see? We got everybody here making us laugh. This is what's fun about doing this stuff. So she's going to do this 5 times. So 5 each side. And then check this out. Roll on your back. She's going to put her feet together, knees bent. Now I got a yoga block here. It doesn't have to be a yoga block. It can be anything. But what we're going to be looking for is we're going to set this disc in the center at that pubic symphysis. Her feet are going to be together, so just put your feet together, grab a yoga block, stick it in between, and all she's going to do is give it a squeeze. Big old squeeze. Bang, you hear the pop. We got country music in the background, you can't hear it. But usually right here you hear this pop. That's that disc that just set. Did you get a little click? So that's pretty cool. And how long did that take? It took like 30 seconds. So we do all that. That's number 1. Number 2 is we need to peel those adductors off of the semimembranosus so you can drop into the bottom of that squat, because the adductors attach on all along the femur and up into that ischial tuberosity. So basically your sit bone, and same with the semimembranosus, comes onto that sit bone as well, but it's going to pull on that pelvis. So I'm going to show you how to peel that apart. Super uncomfortable, really effective. So come here. So I'm going to drag a box all the way in here. I love having props. It's freaking awesome. She's going to sit on this. So she's going to get up on the box, feet facing that way. And I'm going to show you guys where it's going to be. So it's going to be all up in here. And we're going to just completely peel apart all this muscle. And we're going to separate it so it slides past itself, because it's not supposed to be glued down. So when she's on there, she's actually going to lean forward a little bit, so she gets some weight on that adductor complex, including the gracilis and that semimembranosus. So I'm going to have her sit more on the corner. She's going to take this. That's it. I'm going to grab this We're gonna come all the way over. Yeah, that's the one. So now check this out. What she's gonna do is she's gonna, I'm not showing her face because she's gonna make the pain face. She's like, this is so awful. Did you hear that? So there it is. There it is. She'll tell you how awful it is, and she's gonna give a thumbs up anyway because it's friggin' awesome. So we're gonna do that. You're gonna work your way all the way down the inside, all the way into here. Just be careful when you get towards this area because there's a lot of structures that attach here. So you wanna make sure you're not peeling away right where there's the attachment point of the muscle. You're gonna come all the way down. That's it, and she's gonna hit a hot spot, I guarantee it. And it'll be right about there. Yeah, see, that's the one.
It's gonna get worse.
It's just, oh yeah, it gets much, much worse. So I realize Steven Spielberg camera skills, friggin' awesome.
Yeah.
I'm getting a Grammy for this one. All right, maybe a soapy. I don't know if you guys have watched Friends, you know what I'm talking about. So that's number 2. Number 3 is we're gonna hit the glute med and the TFL up in here, that high hip, and even capture a little bit of that, that glute max. So I'm gonna use Dawn one more time. So she's gonna get on the ground and she's gonna sit. You don't have to move that. Look at this, isn't that badass? All you guys that can't move stuff around and you're not having a baby, she's building a person and she chucks stuff around. Savage. So we're gonna take this, it's gonna go high in the pocket here. So when you squeeze your butt, remember, squeeze your butt, not someone else's butt, okay? Squeeze your butt, you're gonna find that pocket, that's where this goes. You're gonna find a spot where you can sit the muscle right in between there. She's checking, she's like, oh yeah, it's right there. Right, see? Put your feet this way.
That's right.
Good, yep. And she's gonna take, gotta love my camera skills. Boom! All right, so we're gonna straighten out, I'll come down real low. We're gonna straighten this one. We're gonna take this one, we're gonna bring it all the way over. This traps that leg. Now she's gonna take that, tuck it underneath on that hot spot. Yeah, see, look at the face. We'll block the pain face. We'll block it. Nobody can see. Millions of people watching. And she's just gonna grind away on that. And what I want you to notice is, I'm gonna turn this just a bit. You can see her foot. We're gonna dorsiflex the foot and we're gonna crank it up like that. So it really, gnarly, right?
Yeah.
So as soon, and see the other thing is, Dawn's a nurse, so you can trust her, okay? She's gonna,
It's trustworthy profession.
it's true, it's true. So we're gonna dorsiflex that foot and externally rotate it. So or internally rotate it rather, so it really captures a lot of that tissue, and then all she's gonna do is grind back and forth on that till she beats it into submission. It's just that easy. See, we need to block that face. That's not what we wanna see. But that's it. So we're gonna loosen up the pelvis and get rid of that shear just by taking the muscles that actually cause that shear and peeling them off the bone and letting them do what they're supposed to do. Hey, we're gonna get that pelvis taken care of so you can drop into the squat. Dawn, Trev, SmashweRx. I'll see you guys tomorrow.